I'm Dr. Ben Newman. I study coronaviruses for a living and read a lot of papers. Let's try to answer some of your questions. I chose this angle for today so you can see my little accent lamp right back there, and the Mr. Coffee, a very important part of our morning. Yeah. All right. First question is from Tanya. Good morning. Let's see. Hello, and thank you for all you do. Yay, sure. I've listened to pretty much all the videos, including the one on office meetings, and so I guess my question is similar. That's fine. Let's go. Um, let's see. My company reopens on the 1st of October. Not many will be coming back to the office, but I'm one of the people who will as I manage it. Yeah, okay. Makes sense for an office manager to be at the office. Otherwise, yeah, right. It makes it easier to manage. And it probably makes it easier if there are some people there in the office. Yeah, so you can keep track of what everybody's doing. I don't know. I don't know how all the different software packages work, but yeah, I can see a role for it. So the office will be far from crowded, but of course there will be movement of people. Yeah, bound to be. People have to go to the bathroom. They have to whatever microwave fish in the microwave. Whatever people do in large offices that annoys everybody else. A one-way system is not possible as it's too narrow. I don't think. I think the one-way systems are easy to implement. I don't know that they make a whole lot of difference. Like far less than mask wearing would make. Because you're trying to, I don't know, channel the flow of people in one particular direction. And I think it's mostly going to be in conversation when you're there next to somebody that the virus is going to spread. And you can have a conversation while you're walking, but it would be weird to talk to the back of somebody's head. So yeah, I think the one-way system, yeah, is probably okay, but it's probably not a. It would not be at the top of my list of things to put in place to safely reopen, as far as that's even possible. Yeah, it's not completely possible, but worth a try. Okay, and so I'm guessing the air conditioner. Let's see. The main concern, I guess, is the air conditioning, as it recycles air as opposed to drawing it in from the outside. That's fine because usually a ventilation system inside of a building is going to run it through HEPA filters. And those HEPA filters are really good at filtering out things like coronavirus. So, yeah, I am not worried about having air conditioning. I'll be worried if you didn't have some kind of air movement like you would get with air conditioning. I mean, it wouldn't have to be air conditioning. You could set up fans to kind of, like fans and baffles to kind of make a little path where the air would generally be flowing. And in general, the more airflow you can get, the better it's going to be, the closer you can get to being outdoors. And it doesn't matter if it's being recycled, especially if it's going through a filter. If not, it'll just be so diluted that even if there's a little coronavirus in there, probably not enough to actually reproducibly start off an infection. So what's the latest research on that? And should we insist the air conditioning be off? Yeah, and in the summer, even in Britain, yeah, which is where I guess you may be from. I would say no. Yeah, you need that air conditioning. If anything, you want to turn the air conditioning up, or rather, you want to turn the airflow up. It doesn't have to be a lower or higher temperature. That does not make enough of a difference to actually be worth the discomfort that you would feel from a very cold and no, just a very hot place would be a little worse for the virus. Very cold would preserve it slightly, but again, not enough of a difference that you would actually notice it, I think, in terms of infectivity. So yeah, that's the conversation to have with whoever's running the building. There are sometimes, at least, and I'm not an HVAC kind of person, but I think there are sometimes ways that you can turn up the airflow, that you can regulate the airflow on some systems. So if you can talk with your facilities people, that would be the conversation to have. But you definitely want more airflow, and you want to avoid pockets of dead air, because if you get virus in those pockets, then it'll just kind of hover there and it will have a greater chance of infecting people around there. And this is based on studies of the airflow in the Diamond Princess cruise ship and in a particular restaurant where kind of the back half of the restaurant, or back third maybe, where there was very low airflow. you had almost everybody getting infected there. It started out with one person and then just boom, spread to everybody else. And in the rest of the restaurant, even though they were breathing more or less the same air, there was more airflow, and the airflow did not come from the back to that area, and so they were essentially fine. So, yeah, more airflow generally better than less. That's at least where the science is right now. But I would say even with that 2 meter distance between the desks, I would say you want a mask and 2 meters if you're going to be indoors for an extended amount of time. Which, yeah, like Dolly Parton said, 9 to 5. That's going to be pretty normal. Maybe with a lunch break somewhere involved. So yeah, I think it can be done reasonably safely, especially if you are minimizing the amount of people in there, maximizing airflow, still wearing masks all the time, and just finding somewhere else to eat your lunch or somewhere with a door. I'm assuming this is an open plan office, maybe, which is why the question is being asked in the way that it is. So there you go. That's the best that I've read and heard so far. I hope that helped. Thanks very much. This has been Ask Dr. Ben.